Welcome to the training, Breastfeeding Friendly Childcare for Advisors. This training is brought to you by Healthy Childcare Colorado and the Colorado Department of Public Health and Environment. This training is intended to provide the knowledge and skills necessary to become an effective breastfeeding friendly childcare advisor. The overarching goal of the Breastfeeding Friendly Childcare Recognition Program is that more childcare providers across Colorado will become recognized and be utilizing best practices when it comes to supporting breastfeeding families. This support, in turn, will help remove the barriers for more parents to be able to breastfeed for longer. This training is for anyone interested in supporting childcare programs through the process of obtaining breastfeeding-friendly childcare recognition. Anyone is welcome to apply to become an advisor. As an advisor, you will be assisting childcare programs in your community to implement best practices in supporting breastfeeding families and achieving breastfeeding-friendly recognition. After applying and being accepted as an advisor through Healthy Childcare Colorado, you should have reviewed and become comfortable with the Breastfeeding and Childcare Toolkit. This toolkit will be referenced throughout the training. Next, you should have completed the Supporting and Breastfeeding and Childcare online course. It is available through both PDIS and CoTrain. The last training component is this slide deck. This is module 1 of 3. We will start this training by building your understanding of the childcare system in Colorado and how the advisor role fits in. We will then dive into the detailed components of a breastfeeding-friendly childcare and what is needed for certification. The next section will involve supporting you as an advisor and your ability to support childcare providers through the recognition process. This will involve guiding policy change, recruiting providers, coaching skills, troubleshooting tips, and how to refer providers to helpful resources. Please keep in mind that this is intended to be a broad training, and some topics may vary across communities, since each community faces unique challenges. At the end of the 3 parts to this training, you will have obtained a stronger and deeper understanding of the following: the importance of supporting breastfeeding families and why this support matters in the child care setting specifically, the role and scope of the advisor position, the basic structure of the child care system in Colorado and how your position as an advisor fits in, the requirements for a child care program to become breastfeeding friendly recognized. You will also gain the skills necessary to guide childcare programs in drafting, implementing, and disseminating a breastfeeding policy for their program. You will learn how to effectively outreach to and recruit childcare providers to begin the process of becoming breastfeeding friendly recognized. This training will also cover basic coaching techniques to guide childcare programs through the change process. Lastly, we will discuss how you can facilitate effective referrals to community organizations to connect childcare providers with appropriate resources. This slide deck, part 1 of the training module, will cover the first 3 learning objectives listed here: why support for breastfeeding is important, the advisor role and scope, and a brief overview of the childcare system here in Colorado. The remaining objectives will be covered in parts 2 and 3 of the training module. Colorado's moms want and choose to breastfeed. With over 90% of moms initiating breastfeeding in Colorado, it is important to provide adequate breastfeeding support to our moms and families. Our goal in Colorado is to increase the number of moms that are able to continue breastfeeding exclusively for at least 6 months and breastfeed at least 1 year. The research shows the most health benefits for both mom and baby occur from longer and exclusive breastfeeding. To increase each mom's breastfeeding success, barriers must be removed so she is able to continue breastfeeding for longer. The values shown on this slide are based on the annual CDC National Immunization Survey Breastfeeding Report Card. Some of the overall barriers to breastfeeding in the United States are a lack of knowledge, both parents and families, but also the public, employers, healthcare providers, and so on. This leads to a lack of breastfeeding support for families in the community. Next, lack of any sort of family leave is a barrier to establishing and successfully breastfeeding. Lack of paid family leave contributes to this as well. Returning to work or school is a barrier to breastfeeding since there is often a lack of support in these settings. Finding adequate childcare is also a barrier to breastfeeding when a parent is returning to the workplace or school setting. There are many current healthcare policies and practices, such as a lack of breastfeeding training as a requirement for physicians, that leads to inadequate support from the healthcare setting. Lastly, the marketing of infant formula companies to families is shown in research to inhibit and reduce breastfeeding initiation, exclusivity, and duration. Free formula gifts are shown in research to decrease breastfeeding success. As mentioned on the previous slide, a major known barrier is returning to work. Evidence tells us that breastfeeding is negatively affected by parents returning to the workplace. However, childcare providers can help reverse this trend. Evidence tells us that when families are offered support from their childcare provider, they are more likely to breastfeed for longer. Since childcare providers play such a critical role, the breastfeeding-friendly childcare model was created to foster supportive policies, systems, and environments to break down barriers for families. You, as an advisor, are a critical component to building healthier communities. Your support as an advisor empowers childcare providers in the community to better help families in their care. We want to extend a huge thank you to you for your commitment to becoming a breastfeeding-friendly childcare advisor. With 90% of Colorado moms choosing to begin breastfeeding, we appreciate your help in breaking down barriers for families to meet their breastfeeding goals. By supporting our childcare providers, you are a key player in the health of families in Colorado. Thank you. As we dive into this module, we want to share some common acronyms that you may see throughout the training. There's several types of lactation experts. The first is an IBCLC. This is an International Board Certified Lactation Consultant. The next is a CLC, or Certified Lactation Counselor. Lastly, CLE stands for Certified Lactation Educator. Other acronyms that we may refer to throughout this training include PDIS, which is the Professional Development Information System. This is a professional development and learning system specifically used by childcare providers across Colorado. WIC is the Women, Infants, and Children's Program. QRIS is the system that's used to assess, improve, and communicate the level of quality in childcare and education programs. And Colorado Shines is equivalent to Colorado's QRIS. Now we will go into more detail on the role and scope of a breastfeeding-friendly childcare advisor. The Early Childhood Colorado Framework is a shared vision that all children are valued, healthy, and thriving. The domains are family support and education, learning and development, and health and well-being. We have many organizations working at the federal, state, and local levels to support quality childcare in our state. Listed here on the right are several key players that we will discuss in more detail shortly. So who is this training for? This training is intended for you. It is for individuals looking to become trained as a breastfeeding-friendly childcare advisor. As mentioned earlier, it is required that advisors thoroughly understand the breastfeeding and childcare toolkit that is referenced throughout the trainings. It is also required that advisors complete the Supporting Breastfeeding and Childcare online training that's available on PDIS and CoTrain. The training modules you are currently taking are also required. This section is part 1 of 3. All 3 parts are required to begin work as an advisor. Lastly, it is required that you are willing to advise at minimum 2 childcare programs, a center and/or family home, in your community that you do not currently work at. Our goal is to increase access across the state to the breastfeeding-friendly childcare recognition program, and we cannot do it without your help. The role of the advisor is fully outlined in the job description document and is also summarized here. To review, outreach. Advisors are expected to conduct outreach and secure the signed breastfeeding-friendly childcare program agreements for a minimum of 1 home provider and/or 1 child care center. Completed agreements can be returned to Healthy Childcare Colorado. Advisors are also expected to work with childcare directors and staff to ensure that the program successfully completes the following tasks to create a breastfeeding-friendly program. This includes completing the breastfeeding-friendly childcare self-assessment tool before beginning this process and after you've completed the final visit, collaborating with program leadership to write a breastfeeding policy supporting breastfeeding for both families and staff, it must guarantee that employees have adequate time and space to breastfeed or pump. This policy should also be included in the family, parent, and staff handbook. Collaborating with program leadership to create a sustainability plan. This should include ensuring new staff training or orientation on breastfeeding, maintaining parent resources on breastfeeding, and maintaining the breastfeeding space and supplies. Next is to provide materials. So this is sharing the breastfeeding childcare toolkit and additional materials, such as the parent handout that is pictured here, to each program, and talk about how to utilize them to create a breastfeeding-friendly program. Next, you'll also be communicating with Healthy Childcare Colorado on a regular basis. They can provide support as needed in your advisor role. Lastly, you will be required to track your work on the templates provided by Healthy Childcare Colorado, and you will need to submit them by the agreed upon completion date. In understanding the role of the advisor, it is important to know what is within your scope of responsibilities and what falls outside of that scope. It is within your scope to provide guidance and support to programs related to best practices when supporting breastfeeding families. You will also be coaching programs through the process of making changes to become eligible for breastfeeding-friendly recognition. It is absolutely outside of your scope to provide any advice on breastfeeding or lactation, as the advisor role is not intended to serve as a breastfeeding expert. This is also true when it comes to medical or childcare licensing advice. This all falls outside the scope of an advisor. However, it is definitely appropriate to refer childcare providers to organizations that may be able to provide more specific assistance. It is not expected that advisors will have a comprehensive and all-encompassing understanding of the childcare system in our state, but it may be helpful to learn about the various types of childcare that exist in our communities, as well as the organizations and systems that support them. There are several different types of childcare settings. Childcare centers tend to be larger, are not located in a home, and are licensed and monitored by CDHS, or the Colorado Department of Human Services. Family childcare homes, by contrast, tend to be smaller and are located inside a family home. They are also licensed and monitored by CDHS. Head Start programs can be run in a childcare center, school, or family home. These programs serve low-income families and may offer additional support for well-being that may not be found in traditional childcare sites. These sites are also licensed and monitored by CDHS. Certain childcare settings are exempt from CDHS licensing. This may include certain types of family childcare homes, depending on the ages and number of children, or occasional care such as babysitting. FFN, or Friend, Family, Neighbor Care, refers to anyone caring for a child. These providers are typically not licensed. The Colorado Child Care Assistance Program, otherwise known as CCAP, provides child care assistance to families who are working, searching for employment, or are in training, and families who are enrolled in the Colorado Works program and need child care services to support their efforts towards self-sufficiency. CCAP provides access to reduced cost childcare at licensed childcare facilities or qualified or unlicensed providers. The Child and Adult Care Food Program, otherwise known as CACFP, provides qualified childcare sites with reimbursement for serving healthy meals and snacks, and this includes breast milk. Childcare sites are regulated by several entities. The Office of Early Childhood in the Colorado Department of Human Services oversees licensing requirements. Local public health departments oversee health inspections. These inspections occur at varying time intervals depending on the county. You can visit www.coloradoofficeoferlychildhood.com for more details. Colorado Shines is a quality rating system run by the Colorado Department of Human Services. All licensed programs have a rating. Those with higher ratings have met certain quality criteria determined by Colorado Shines. A Colorado Shines rating, levels 1 through 5, means that a program is licensed, in good standing, and meets health and safety standards. It also means that the program is regularly reviewed by state officials. Programs with the higher ratings, so levels 3 through 5, have gone through a process to demonstrate high-quality programs and practices in all of the areas that Colorado Shines reviews. For more information, please feel free to visit www.coloradoshines.com. In summary, in part 1, we covered the rationale and reason for why breastfeeding support is important in the childcare setting. We discussed how about 90% of Colorado families start out breastfeeding, but by 6 months, only 30% of moms are still breastfeeding exclusively. By breaking down barriers and supporting families, we hope to support more moms breastfeed for longer and meet their breastfeeding goals. We also discussed the role and scope of the advisor. You are able to provide support and referrals through the breastfeeding and childcare process, but you are not qualified to give lactation or medical advice. Lastly, we reviewed the childcare system in Colorado to raise your awareness of the organizations and programs that support our variety of childcare providers throughout the state. In part 2, we will dive into the details of what is required for a childcare program to become recognized as breastfeeding friendly. We will also go over techniques and skills that you can utilize when facilitating and guiding policy change with programs. To view the resources discussed in this module and for more information, please visit breastfeedcolorado.com or healthychildcareco.org. Thank you, and we will see you in part 2.